Hi everyone, this is Mike Childress at the University of Kentucky. It is about 1 o'clock, and I see that on the line we have Lars Powell, we have Christine Bevick, and Jackie Scott. I believe that Chris Nelson, Chris, you're showing up in one part of my Adobe Connect screen, but not in the other, so I'm not quite sure if you're logged on or not. Are you there? I'm taking that Chris is either not on the line or is on the line but is not connected via telephone. Can the others hear me? Let's just make sure that I'm not talking to empty air here.
Yes.
Hear you. I can
Okay,
hear you. Michigan.
Great, thank you. Fantastic. Glenn will not be with us today. He is participating in a dissertation defense as a committee member, and so that's going on right now. Anna will not be here, and Chris, our work group chair, Chris Nelson, told me, I believe yesterday, that he's traveling at this point, and felt that his cell coverage might be a little bit iffy. So I'm not sure what Chris's availability is going to be. And I also talked to Bob Burhans yesterday, and Bob is also traveling today, which is why he called me yesterday to talk about some things. And so Bob might be joining us via telephone, or I suspect probably not. Why don't we go ahead and get started? And the names that I mentioned before are still the names that I see on the screen. Since it is 1:02, let's just go ahead and proceed. Let's see here. And I think I've got control of the slides, and I do. So on the agenda today, I want to update work group members on where we are with some of these things that we've been talking about really since our July in-person meeting. I want to share with you a revised, slightly revised timeline. As you can see on the slide, if you're logged on, we have changed the deadline for new measure submission from today to the end of this month, or nearly the end of this month, October 28th. We're still hoping to use the month of November as a public comment period, and so we thought about extending it to November 4th. And if you looked at the slides that I sent to you this morning, those slides do say November 4th. So if you look at those and you see November 4th, just know that we talked about it after I sent those slides to you and decided that we needed to respect that month-long comment period and cut off the submission date sooner rather than later. So I'm on slide 3 currently, and just to recap, a month ago we went over some work that James had done previously, and I think had refined somewhat, but really, of course, it was, if you were on that meeting, you saw that he did a tremendous amount of work to look at some of the major national preparedness frameworks and to identify both areas of overlap and, by implication, the gaps between those major frameworks and the National Health Security Preparedness Index. And so, and we list here some of the frameworks that we're aware of and have been thinking about. And so the issue there was, well, given that there are gaps that are identified, and I'm going to show those on the next slide, I wanted to make a nod to a point that Chris Nelson has made many times over the last couple of years, which is that the real question, if we stand back, is, what is the purpose of the index? And so what I have here is a brief paragraph, or really not even a paragraph, a sentence, that briefly describes what the National Health Security Preparedness Index purports to be. And this is taken directly from the website. The index, and I'll read it, measures the nation's health security and preparedness, that is, the nation's ability to prepare for, respond to, and recover from large-scale health threats. And so within this context, one of the things that Chris, and if Chris is on the line, I'm about to ask him to add on and embellish anything that he wishes to add to this, is that there are many areas within which we could see our niche. And within these broad conceptual areas, they include things like preparedness and response, prevention, mitigation, recovery. And so that's why I have a question mark after this. And Chris, are you on the line? So it sounds like Chris is not on the line. And so obviously he's not going to embellish anything here, but this is an area that I just want to put out there. If you all have any strong ideas about where you see this the index's comparative advantage, and if you don't, that's fine too. But if you want to make a case for us to focus in any particular area, a conceptual area, and maybe it's not necessarily one of the things that I've listed here of those 5 words, maybe it's something else. Please offer it.
This is Jackie. I don't think that we should be picking one of those particular areas. I mean, really, preparedness is about all of those areas. And if you start trying to limit, I mean, mitigation or prevention or response or recovery, when you're talking about a health security preparedness index, that doesn't say to me it's only about preparedness or response or it's only about recovery. When you talk about prevention, I mean, we're looking at immunization rates. That's prevention. And mitigation across public health means a lot more than it does just for Homeland Security. So that's my 2 cents on it.
Thank you, Jackie. It's interesting that the length of time that I have been involved in this work now, which I guess is a couple of years, this is a question that does not go away. We continue to ask ourselves, what is our mission? What is our purpose? What is our focus? And I think to this point that we have adopted a posture similar to what you expressed, Jackie, which is to keep it broad and somewhat ambiguous, because so many of these things affect preparedness or related to it, obviously. Any other comments about that?
Mike, this is Lars. Can you hear me okay?
Yes, sir.
Okay, I'm on a new headset. So I understand there's other measures kind of like this, other indexes. Do those tend to have specializations, and by not having one, does this index become less useful? I mean, it seems like it's pretty clear that a good index would cover all of these things, but if it's going to be so broad as to not be useful or to be overwhelming or whatever it might be, then I agree that our charge here is to have a pretty broad index. I'm just trying to think practically about, you could have a really good product here, and then if nobody uses it, then it's really not that great.
Right. Well, so Jackie, I'm gonna direct a question to you on this, since you were part of the previous work groups and worked very closely with the folks putting this thing together. I know that when we took it over, the idea was that we wanted to incentivize or encourage, maybe is a better word, encourage, let's say, non-traditional sectors or groups, entities, non-traditional, let's say, public health, emergency preparedness, emergency management groups to embrace this index, because I think that the guiding philosophy at RWJF was that we see, and again, this is consistent with the culture of health work, we see this as something that many entities, groups can play a role in and have responsibility for. And by narrowing it down by making it too narrow, we would necessarily exclude groups who we want to encourage to think about this stuff. And so that's why we have continued to, I think, keep it very broad. And so Jackie, when this thing, you were part of the group, the original intellectual architects of this.
Right.
What was the perspective then on that?
Well, I think the perspective was to include, all of the components of preparedness and the partners and even non-traditional partners as part of the cohort that values and utilizes the index. Mm-hmm. So, as you were taking it over, we were trying to add more from healthcare, not just hospital preparedness, but healthcare in general, and more from emergency management and more from environmental health. Pulling those in, they're a little harder to deal with and to get engaged. Right. But it was clear that if they're going to see themselves and find the index useful, the index has to be broad enough that it encompasses them also.
Right. Well, and Lars, I will just say that this is something that we're still working on. This is and this being getting, and again, I'm doing air quotes here, but the non-traditional groups, whether in the nonprofit sector or the private sector, to really pay attention to this stuff. And it's it's an ongoing process, and hopefully we'll get some. We're constantly working on ways and strategies, and I know the stakeholder engagement working group that Anna works with, as well as the folks who RWJF have as PR firms. They're constantly working and thinking about ways in which they can use social media and other avenues to bring in more folks to inside the tent.
Sure. And Mike, I was only asking as kind of a catalyst to clarify our thinking. I'm not disagreeing with Jackie or really have a strong opinion. So just want to make sure we had a reason for thinking what we were thinking, and it sounds like we do.
Yes, I think so. Thank you, James. I see James is on the call now, and so that's a nice segue to, on slide 4, that based on James's analysis that he presented to us last month, I've identified really 3 big categories where the gaps seem to be. based on James's analysis. Information sharing across sectors was something that James had highlighted in his presentation, and then Chris Nelson followed up a little bit later. I think that to build on that James had talked about the across, let's say, the countermeasure management sector and the healthcare delivery sector. Those were the sectors, the domains, I think, that James was referring to. And James, please interrupt or interject to at any point to clarify.
No, I think that makes sense. A new piece that had come up, I don't remember if I mentioned it on the call, was that within that we had folks here that said that that's where some of the cybersecurity information might also be housed.
Okay. But then related to that was not on the slide, was something that Chris Nelson had talked about, and that was specifically the state and local government's interface. And so we know that in terms of additional measures or new subdomains, domains, that this is an area that we could probably bolster. A second area, one that we're currently working on, is to improve on the number and quality of measures in the environmental and occupational health. We have a couple of things going on in that area I should update you on. First is this measure hunt, and we're focusing really on the first responder fatalities, and we've been communicating with people at the Bureau of Labor Statistics to try to get the data from them. It's available on the website, but it's very cumbersome to get, and so we're just trying to get them to email the machine-readable data to us. But in addition to that, when the NAC feels like this is very important, in one of the recent NAC meetings, they decided that it was necessary really to try to convene a separate work group of folks to get at this, and Anna has been taking the lead on that. And so I think that the hope is that maybe by January there'll be a group of people who are quite knowledgeable about this to come up with some ideas, kind of like a little mini work group, ideas about how to think about, operationalize, and measure this. But until that time, we're collecting this BLS data. Then the third bullet here is the recovery part. The pre-event community status was a proposed domain that we had put out there for consideration a year ago. And there were a number of things, and this is taken directly from James's slide, the health and social services, the housing, the infrastructure. There's I will add that on the infrastructure topic, one measure that we're looking to include this time if we can, I've got some emails out to folks at EPA, is to have a measure that captures wastewater infrastructure. As some of you may know, the Professional Association of Civil Engineers produces a national report card every other year, I believe it is, where they evaluate the nation and each of the states in about, I don't know, maybe a dozen different categories of infrastructure, and wastewater is one of those. And so there are data out there on stormwater overflows and sewer overflows, and so we're trying to, as I say, I've been reaching out to people at EPA to try to get some of these data and get their input on how one might again measure and operationalize this. So that's a possibility. And then Chris, have you joined us yet? Chris Nelson?
I just joined right as you were saying that, so my timing is
well, wonderful.
good or bad.
So I'm on a slide here that lists 5 items, beginning with infection control treatment guidance to clinicians, down to decon. Why am I having such a hard time saying that word? I can say decon, but do you want to talk about this in the context of proposed, new measures to think about? And these were ones that you had submitted last month.
Yeah, I can say a few words. First of all, I have to confess they are at the level of concepts, not yet specific measures. As you know, I spent a little bit of time just looking around at various frameworks and logic models of preparedness, just trying to shake the tree a little bit harder to see if I could find things that we perhaps weren't measuring. And I unfortunately can't see the list right now. I'm in the back of a car and a cell phone. But infection control guidance for clinicians was one of the things that came out of some work that the European CDC has done on infectious disease responses, for instance. So as I looked back through the NHSPI measures, I wasn't able to find anything that to me looked like that. Decon was another one. I think yet another one that I know has been kind of an interesting issue over the years is the public health role in mass care, whether that's monitoring conditions in shelters and mental health for people in shelters. So these were just attempts to identify things that might be important, but I had not yet gotten to the point of proposing specific measures. Mike, does that help?
Yeah, there are 2 more things that, 2 more bullets there. One was business preparedness, and another is plans for families of first responders.
Hey, Chris, this is Jackie. Were you business preparedness? Were you thinking business continuity planning, or just in general?
Yeah, essentially that. Yeah, and the idea is that people spend a lot of time at work. That's what we're all doing right now. So that is an important venue for strengthening the resilience of communities. So yes.
So I would say that if any of you, as you look at this list, if something, if a light bulb goes on and there's something sparks inside of you and you think, I'm aware of a data source, or I have some ideas about how to, measure this or operationalize it, let us know. Follow up with an email or offer your comments now. Okay, thank you. And then there were, to kind of finish out on this, the topic of alignment, we had, and again, Chris, this was something that you followed up with me in an email this week. There's 3 bullets on this slide. The first one is healthcare coalitions. The second is federal funding. And the third is non-federal sources of preparedness funding.
Yeah, I can say a couple of words to those. I guess one thing that occurred to me with federal funding, I wonder if there's some way we may want to try to measure the variability over time. My sense, and I'm sure others on the call can speak to this more directly than I, but the unpredictability of federal funding, I believe, has been a concern over the years. The part about non-federal sources, I seem to recall, and again, this was years ago, but I seem to recall that there's some talk at the beginning of the, kind of the post 9/11 push in public health preparedness that over time there was a hope that more of this could be taken up by non-federal sources. That the federal money was kind of a bit of a kind of a starter grant in a way. I thought if someone has data on that perhaps could be useful.
And so, Chris, so non-federal sources of preparedness funding, would this be like still governmental, but state and local?
Yeah, that's what I had in mind. I think it would be nice to get at non-governmental, business investments and continuity of operations planning and things of that nature, but I imagine that would be a lot harder to observe.
Yeah,
Right.
Chris, it would be very hard, but I wish there was some way we could capture all of the match contributions, if you will, of NGOs and our business partners. So, for example, the companies that contribute to us their facility for training and exercise for RSS for the Strategic National Stockpile, more than one company doing that. You know, if we could, that would be fairly powerful if we could capture the facilities that say they're willing to be closed to points of dispensing, you know, like DTE Energy, or I just don't know how we would go about that at this stage, but it could be pretty powerful in terms of an addition to the index. So I like the way you're thinking.
And Chris, did you want to say anything about the healthcare coalitions?
Yeah. You know, I guess coalitions are kind of an interesting manifestation of this move to try to weave together public, nonprofit, and non-public private sector resources together. I believe the Healthcare Preparedness Program and the Office of the ASPR, I think they keep data on coalition membership, number of coalitions, number of coalition partners. And in many cases, and Jackie could speak to this in more detail than I could, you know, a coalition might be a health department, emergency management agency, EMS agency, but also a number of privately owned hospitals, healthcare networks, other partners of that nature. So I think it might add to the section of the index on healthcare, but also kind of hit at this cross-cutting issue of partnerships, which you know, is also something that's coming up strongly in the culture of health work that Robert Wood Johnson is doing.
Yeah. So for the new cooperative agreement coming out in 2017, there may be some changes in terms of framing the healthcare coalitions and numbers and makeup of the healthcare coalitions. But I'm telling you, ASPR has collected that information enough times, they should be able to provide it back.
Well, I'm going to follow up with Glenn on this one because, you know, he seems to be pretty knowledgeable about what's going on over in ASPR, and I know that he's got you know, some contacts over there, so we'll see what we can do with that. Any other comments?
This is James, and I have just a comment going back, which is we talked about environmental and occupational safety, and then I know you're going to jump into, or you mentioned the decontamination. I think it's important to think along the lines of the infrastructure you're talking about with EPA around sort of the prevalence and maybe the population that's attributed to an area with a brown site or other hazardous materials or waste management pieces. So I would just make the suggestion to think a little more broadly about that than just the wastewater, because I think there are some other contributors that we should think about. And it may be that sites that have been remediated. I'm not entirely sure what the indicators might be, but I like that track.
Okay. If you have some additional thoughts, I mean, I've written this down, what you've just said, but if you have some additional thoughts, please email them.
Will do.
Because, yeah, I'll kind of poke around too, but I would like to leverage your knowledge and expertise in this area too. Okay, thank you. I'll just add a little thing about the funding stuff. We did pull the data a while ago from a couple of funding sources. It was federal funding, and I know that Glenn has played around with that data a little bit, just to looking at the funding, the relationship to index scores, but we're not too far along. But so it's kind of on our radar. It's more than kind of, it's on our radar, and we'll continue working on this funding. topic, the federal funding stuff for sure, because we, like I said, we've got some of that data. Okay, individual level of measures of preparedness was something that I've spent a lot of time on between our last meeting and today. You know, we really wanted to add a new measure that was captured at the state level, individual levels of preparedness. I mean, there are a lot, it seems, I've discovered a lot of surveys, a lot of survey questions. BRFIS is one. FEMA does a national household survey. There's a general social survey. HUD, the American Household Survey. There, particularly the last one there, the HUD, the American Household Survey, well, and the FEMA one, the National Household Survey that FEMA does. I mean, these are rich sources of data on the preparedness of households. The problem is that they do not have, or they are not releasing state-level identifiers. In part, in the case of FEMA, because, and Gallup is their contractor to do this, even though they had, 5,000 respondents, well, that just really wasn't enough for them to feel comfortable about generating state-level estimates for preparedness in many different ways. Things like, do you stockpile, do you have 3 days of water? Do you have have you backed up your financial documents or made copies and put in a secure place? Things of that nature. Do you have a household plan in case of an emergency? But in talking to the person who directs that survey at FEMA, their goal is to ultimately increase the sample size and design so that they do generate state-level estimates, and they hope that comes sooner rather than later. The other rich source of data is the HUD, American Household Survey, and there are I don't know, maybe 10 or 12 questions that get to this, and it is a huge sample size. But they don't release in the microdata or in the aggregate data that they release to the public, the state-level identifiers. And it's interesting is because of confidentiality issues, they have, in talking to the people at Census who construct this, that there are a couple of areas in the United States where it might be possible, because of the sample size and because there's a zip code identifier and because there's a question on temperatures, that you might be able to do a bit of detective work and trace it back to an individual, a response, a series of questions to an individual household. And so they have removed the state-level data to guard against that, to my great chagrin. And so that is, unfortunately, these sources are not currently available to us. We have talked about possibly treating this as a kind of like a foundational measure. If you recall, I think we have about 18 foundational measures of the 134 currently in the index that where the states all have the same value. They all participate in the behavioral risk factor surveillance system, for example. And so everybody has the same score. And so we have thought about using that approach to some of this, where we have national level estimates. Any thoughts about that? Just giving every state the same value, like X% stockpile water, or X% have a plan.
I don't know what we gain from that if what we're trying to do is differentiate across states.
Right. I think that with the idea with the foundational measures is a little bit different. it's the same in the sense that it's a constant, it's not a variable. But it's different in the sense that those were things that we wanted to encourage all states to do. And so even though they had all achieved them, we had originally, Lars, taking them out of the index because they were no longer variables. But then the thought was, well, they should still be in there because we want to keep the focus on this, and we want to, you know, we want to encourage states to continue thinking about, you know, fill in the blank, these 18 things, that they represent or constitute a basic level of preparedness. These would be a little bit different. So, I mean, that's a great question. What do we gain by having them in there? They're not exactly the same as the foundational measures in that they don't represent state actions, they represent individual actions, but they represent those things represent state actions that all states have achieved. These are individual actions, and not every individual or household has achieved them. Okay, any other ideas of, if you come across any other sources of data, let me know, because we're eager to include something in this area. Now,
James, and I want to just say that I'm intrigued by the idea of this quasi-foundational measure. I need to think about it more, but I also know that, for example, like even on the BRFSS, while few states are asking the actual module, I know like for our instance, we ask one every 3 years, and we've added state-added questions, which are different than the whole module. I don't know whether or not CDC is tracking that on a state-by-state basis. If not, they should, because they could provide that data, and it may be a measure of who within the last 5 years has asked this type of information, and it could be either state-added or the actual module. But I think that you should understand from their perspective what those numbers are before you make a decision to throw that specific one out.
well, you can go to the BRFSS website, and that data is available for the last several years on the states that have used the module, the preparedness module, and it's only like, I think I pulled the data for the last 5 or 6 years, and that module has only been used in 2 of those years over the last 5 or 6, and in the 2 years that it was only used by 2 states each year, and there was a common state, I want to say it was Montana, in each of the years. So only a total of 3 states have used it in the last 5 or 6 years. So it's just
correct. But what I'm saying is that as states develop their surveys, we have the option to add state-added questions, which may be parts of the module, not
I see.
the module, so it won't count or show up. Or we may have created our own questions that we've cognitively tested that we do ask that do not show up anywhere. So, for example, I know that for Rhode Island, we're piloting a preparedness perceptions module this year.
Okay, so
CDC has that data for you. It would not be on the websites because it's part of the state-specific surveys, but they may ask just the food and water question and nothing else. That won't show up as counting across states.
yeah. Now, I guess one problem would be that, so you guys are working on a specific question for Rhode Island, but I don't have it for the other 49 states, right? Probably.
Correct. But the measure itself could be whether or not you're even collecting said information on the individual level.
I see. Okay.
As a proxy.
So whether a state is either participating in this module or fielding questions that are in the area of preparedness.
That's what I'm thinking if we can't get to any of the specific data based on the unavailability from FEMA and HUD.
Okay.
Yeah. So, I mean, the other thing is states doing CASPER, which is community assessments. And then the hospitals, healthcare systems are supposed to be doing their own community assessments. So I think there's some other pieces out there. It's just how you get to that. It gets more difficult. Important, but how do we get to it?
Okay. Let me write this down. Okay. Thank you. Lars, I'm on slide 7 now, occupational health, and the first, I've really kind of covered already the BLS data, emergency responder and health fatalities, but then the second bullet has to do with workers' compensation claims. And I think this was something that I believe that you discussed or possibly even brought to the table at the July meeting. And could you say a little bit about this and how one might approach creating a measure that captures the workers' comp data?
Sure. So the workers' comp data is, there are parts of it available, and you can get it at the state level. It has a number of drawbacks to use it in something like this. And I guess it's worth just going through them briefly because, well, any measure is it's hard to find a perfect measure of anything, but one of the things that seems like we've been somewhat careful about is not to put out measures that wouldn't that wouldn't treat a state fairly in the assessment. So one of the things is the confounding events. If what we wanted to look at was first responder workers' compensation claims, then the states with disasters are going to have more than the states without. That's a bias that's inherently in them. Now, that being said, states with disasters might be where you need more safety and loss mitigation for first responder workers' compensation. So it might be something that's still a very valid measure. The other thing to contend with is that the benefit levels differ across states. So California has a relatively high medical benefit. Alabama has an extremely high medical benefit compared to surrounding states. There's also different definitions and timelines for the indemnity or the lost work time benefit. But what we could probably back out of that is some rough estimate of days of work that were missed due to on-the-job injuries, which would be less biased by the generosity of the medical benefits, and we could control for a lot of things. I guess at the end of the day, my concern is that it would be messy, and it would take some elbow grease to collect this, unless we've got some budget that we could buy it from a vendor.
Okay. Well, if you have some information about what it might, I guess what it might cost in order to purchase it from a vendor, and then we as a group could, and along with the people who control the money here for the project, could think about the benefits and the costs.
Yeah, and I'm happy to ask somebody for that. I will just kind of say up front that I don't have high hopes for this being a great measure for this index. Okay. Okay. Like I said, I've got to call into somebody at Verisk that has these data, and they file rates in every state. So or in every state that doesn't have a workers' compensation monopoly, and then those states we should be able to get the information from directly. So it's possible that we could buy it and then just have to collect from 5 states and then put it together. And so that wouldn't be too terribly onerous, and it's something we could update without too much trouble. So it's worth looking into, and I'll be happy to do that in the near future.
Okay, thank you, Lars. And I'll add that with all of this, we have we picked the low-hanging fruit for the 2017 release, the stuff that we can get to now that we feel good about. But maybe some of this other stuff is what we work toward over the long term. The other sort of big change that we see as a very strong possibility here is our intention is to add DC this time. And then beyond that, we're thinking that we need to try to integrate and include, I'll say, the territories. It may be more than likely just, a subset of the territories, and the major cities outside of just DC. And I have listed here New York City, Chicago, and Los Angeles. And so what we're doing now is trying to get our arms around and understand what data are available at the territory level, and what data are available at this major metropolitan area, and we'll complete that by the end of the month, because we want to be able to include in a document that we'll release in November that I referred to at the beginning of this conference call on proposed changes to the index. If we're going to add territories and cities, we want to be able to include that in this document. But before we can do that, we really need to know whether, to what extent their data are available. And we still haven't worked through, if we were to include them, how we would do that. Would we just don't know. I mean, would that be part of the website where they're treated equal to states? I kind of doubt it, because you're not going to have the same kind of data available. But maybe that's a button that you click to get information, best as we have it, on the preparedness levels for some of these other entities. Any reaction to that?
Yeah, if we're going to do that, it might be worth your while to talk to someone like Marissa, who's the preparedness director for New York City, and get her input. She's very smart, and New York City is, everyone knows what New York City is.
Right.
But I think it would be worthwhile reaching out to her and seeing what she might have to say about. I'm sure she would agree with adding the city, but she's pretty smart. I don't know what James might like to comment on that, but I think it would be worthwhile to try to add a representative from one of the preparedness representative from one of the cities.
Yeah, this is James. I can agree that with Jackie that I think it would be extremely beneficial, especially given their project that they're undergoing for their own types of measurements. And I think in some ways it may be complementary or at least informative. So I do suggest that we consider doing that.
Mm-hmm.
Yeah, and her last name is Raphael, Marissa Raphael.
Okay. Okay. We'll do that. And I know that. in July, we talked, the conversation I think was more about adding the territories. And I think that the recommendation from the group then was that, yeah, this is a great idea. We might not be able to do it this time. Not saying that we can't, but, you know, we recognize that this might be a long-term, a longer-term process. But that I believe that the Jim and others said that it would be a good idea to maybe create like a little separate advisory group or work group of people, maybe directly from the territories even, or maybe even in this case from the cities, to really engage them more directly about how to do it. But and so we heard that message, and that I believe is what we'll probably do if we go down this path. But right now, you know, we're operating at a very basic level and just trying to figure out, of the 134 measures, how many of them even translate or are available at the city or territory level. I mean, for example, the single largest source of measures that the index leverages now is the APHL, the lab data. You know, and then of that, the CLSS survey, which we get, I think, 20-something measures from, does not collect data on the territories. Now, in the all hazards survey, they do collect data, but only for Puerto Rico. So right there, you know, I see we're going to be short a lot of measures, but there, you know, a lot of data are available for the measures, and certainly a lot of data are available for the big cities. So we're in the process of really just trying to get our arms around that right now. But I think it's a great idea, and I appreciate the contact information for Marissa. Okay, update on the timeline. I think I presented this to you. I may not have, maybe I didn't, last month. This is our timeline. As I think about it, I don't think I had this. I had used this for a different group. We're in the middle of the data collection currently. That's probably actually going to extend from June to December. We had a conversation with APHL 2 weeks ago, and they are fielding the all hazards survey. I think that they put it in the field last week to the labs, and so I think we're thinking that it might be early December before they're ready to share that data with us. We have an event this week, actually, on the 21st that you may have some interest in, and I'm going to talk about that, I think, on the next slide. The call for measures has been extended to October 28th. So if any of you, I mean, you're not obligated to use the button. There's a button on the website, but if you want to share this information with other people, you can tell them, you know, go to NHSPI.org and click the button to suggest a new measure. But also, you can just send an email to me, of which each of you has my email address. But the deadline for that has been extended to October 28th. Our expectation is that we'll use the month of November for the public comment period, and then through January, February, do the calculations and get some preliminary findings and results together that we'll send back out to the states and other stakeholders, as similar to what we did last year, to get that input. You know, we're still looking at a late March release date, although when we talked about this morning, we were reminded that a year ago we were aiming toward late March, and RWJF asked us to push it back into April, which we of course did, because the county health rankings was being released, which they fund also, of course, was being released in late March, and they didn't want these two things stepping on each other. And so we realized, we just were reminded of that this morning, so we have to reach out to RWJF and really talk to them about this as well. But right now we're looking at March. I don't know, maybe it's going to extend into April. This virtual event this Friday and here's the information to log on. You can see the folks who are going to be on there. Right now there are, I think, about 260-something people from 41 different states registered for this event, which in my opinion is quite good. We expect the registrations to increase between now and Friday for this event. It's an hour-long event. I don't think that there'll be any breaking news on this for you all. It's designed more for people who are less familiar with the index, but you might find it interesting if you have the time to log into it. There's the contact information. Does anybody have anything else that they want to add or comment on before we end the meeting? Well, I thank you, as always, for your time and effort, and encourage you to let me know if you have any ideas, anything occur to you later. And we very much appreciate your time and effort and energy in this effort. We really do. So thank you.
Thank you.
I hope you guys have a great rest of the day.
Thank you.
Thank you. Bye.
Thank you.